We talk about the changes the legislature made to the CHIP program this last session. Give us an overview on the issue of uninsured children in the Valley. What are the statistics? How bad is the situation?
The situation is pretty bad. The state percentage at 22.6 is far below what we have in uninsured children in the Valley. It's closer to 40%. About 102,000 children currently, based on school enrollment in last year. 26,000 children lost coverage due to CHIP changes in 2003 and 2005. So it is important that we reach the families first to regain coverage for these children, and then have families sign up every other eligible child.
Welcome to Borderline. My name is Amanda Flores, and in studio, a very special guest, somebody who visits us quite often here on the program. We have Luisa Saenz, who's director of the Children's Defense Fund, and we are here to talk about back to school.
We had some very serious situations, as a matter of fact, even to the point of death in the case of a child in Houston. In the Valley, we had 3 families whose children's health were threatened drastically, and we were able to negotiate to have the coverage restored. Those children are back on CHIP. Their medication, their treatment is continuing, and thank God they're safe now. These changes now, as of September 1st, are going to make a big difference for those families and others who have suffered due to the cuts and interruption in services because of system errors.
Now, about the CHIP program, who qualifies?
These are families that earn more than to qualify for Children's Medicaid, but not enough to afford private health insurance. That, for instance, for a family of 4, they can earn between $1,721 and $3,442 a month and qualify. They could qualify.
Wow.
So that's a great advantage. The other is that the family assets have doubled from $5,000 to $10,000. A family wanting to save for their children's college education is now allowed a little more leverage there. The other is child care deductions are now being considered. And that's very important because a lot of families lost it just by virtue of the fact that they were paying for child care and it wasn't taken into consideration. So effective September 1st, if you're a working family, if you're paying for child care, yes, you can deduct that. It will be taken into consideration for eligibility.